Okay, so welcome to this video. In this video, what we're going to talk about is atherosclerosis. Okay, so the structure then for this video, we're going to start off with some prerequisites to a discussion of the pathogenesis of atherosclerosis. Okay, so we're going to start off with a discussion of the structure of an artery. Okay, so we'll see the different layers of an artery wall. Then what we'll do is we'll have an in-depth discussion of the structure of low-density lipoprotein molecules. Okay, and we'll then move on to the pathogenesis of atherosclerosis. Okay, and how you build atherosclerotic plaques. And then finally we'll come on to what the consequences of atherosclerosis are. Now, this disease is incredibly important within the Western world because it's now estimated that 50% of people die because of in the Western world, of course, die because of complications that arise due to atherosclerosis. So these include coronary heart disease and also cerebral infarction, i.e. a stroke. Okay, so this disease is hugely now studied basically because of its importance in pathology. Okay, but it's fair to say that it's nowhere near as feared as you would think it ought to be. Cancer, which kills around a third of people within the Western world, is far more feared than atherosclerosis. And I think the reason probably for that is that it's the decay in cancer that people hate. It's the cachexia, the gradual fading away of people with cancer as the tumour just uses all of their nutrients. Whereas atherosclerosis, people don't fear heart attacks and strokes nearly as much as they fear being diagnosed with cancer. And I think it's probably because heart attacks and strokes are much, much quicker and you don't have that gradual disintegration. Okay, right. So let's start off then with the structure of an artery. Okay, so atherosclerosis tends to occur within arteries. Okay, and the reason for that is, as we'll see, one of the key things which triggers atherosclerosis, at least the very beginning of atherosclerosis, is damage to the endothelial cells. Okay, and in arteries you have much higher blood pressure than you have within veins, and high blood pressure is one of the key things that is damaging the endothelial cells, and therefore the endothelial cells in veins are much less likely to be damaged. Okay, and therefore you don't get the pathogenesis that you get within the arteries. Okay, so let's have a look at a structure of a large artery then. So you can imagine that we are cutting through maybe the carotid artery. Imagine we're cutting through the carotid artery, the common carotid artery, and we're having a look at what we see inside. Okay, so we'll start off with the innermost layer then here. So the innermost layer of the wall of an artery consists of endothelial cells which are sitting on a basement membrane. Okay, so I'll start by drawing the basement membrane that they're going to sit on. So in turquoise, this is going to represent the basement membrane which all of the endothelial cells sit on. Okay, and it mainly consists of collagen, but it will also have other proteins in there such as fibrillin and also laminins. Okay, right, so now what we're going to have is we'll have endothelial cells sitting on this basement membrane. Now, this is a little bit of an under-exaggeration. You'll probably need far more endothelial cells than this to make up the lining of one of these massive great arteries, but at least for a picture it gets the point across. Okay, so here are the endothelial cells, and they'll have nuclei, so let's give them all nuclei. Now, endothelial cells are very flat cells. They're often compared to fried eggs because when you see them from above, we're seeing them from the side. So if you were to look at one from above, so if you were to stand in the lumen and look down at one, what you'd see is something that looked like this, basically. Okay, so this is the periphery of the endothelial cell, which is like the white of a fried egg. And then right at the center, you then have the nucleus, okay, which is like the yolk of the fried egg. Okay, and these cells are sitting on the basement membrane of collagen, okay, and then you'll have the neighbouring one here. And between neighbouring endothelial cells, you'll have very tight adhesions so that there isn't gaps between the endothelial cells. Okay, so if I draw in another one here, it'll be like this. Okay, so that there are no leakage, basically, out of the lumen of the blood vessel into the layers underneath within the wall of the artery. Okay, so that's labelled up what we've drawn so far. And we're going to need nice long arrows because we're going to put the other layers around this. Okay, so these are the endothelial cells. Okay, and they're a squamous form of epithelial cell. Squamous just means that they're very, very flat. Okay, and the name for the entire covering of endothelial cells sitting on the basement membrane is the endothelium. And endothelial cells are often just abbreviated to ECs, which is an abbreviation we'll use a lot later. Okay, now, the other thing that we've drawn so far is that they're sitting on this basement membrane. Now, all epithelial cells have a basement membrane underneath them. So whichever epithelium you go to in the body, you'll find that underneath that epithelial cell there, you have a basement membrane on which all of the epithelial cells are sitting. Okay, so this is the basement membrane for these endothelial cells. Okay, right, so let's move on to the structure, well, the layer that is underneath the basement membrane now. Okay, so this is the layer that's going to be absolutely crucial to a discussion of atherosclerosis. Okay, and this is a layer known as the subendothelial connective tissue, and this is where atherosclerosis is actually going to occur. It's going to be an engorgement, basically, of this layer. Okay, so this is a layer of connective tissue, so you'll have a lot of connective tissue, so collagen and things like that, and within it you'll have blood vessels, potentially little capillaries that might supply structures within it, things like that. Okay, so this is what's known as the subendothelial connective tissue, or it's also sometimes called the subendothelial space. Okay, and it's going to be the crucial site of atherosclerosis. The main bulk of the atherosclerotic plaque will actually be present in this layer of subendothelial connective tissue. Okay, right. Now, there's one more layer that I need to now show around the subendothelial connective tissue, and we've then completed the first major layer of the wall of an artery. Okay, so in blue here, going around the periphery of the subendothelial connective tissue, this is going to represent the internal elastic lamina. Okay, right. So there in blue, this is supposed to represent the internal elastic lamina made up of proteins such as elastin, which are very, very elastic. So this is a nice stretchy layer. So this is the internal elastic lamina. Okay, now the combination of these four layers that we've now discussed, the endothelial cells, the basement membrane, the subendothelial connective tissue, and then the internal elastic lamina, all four of those together are now called tunica intima. Okay, so the wall of an artery is generally split into three layers: tunica intima, tunica media, and then tunica adventitia. Okay, so this is the first of those three layers that's closest to the lumen of the blood vessel. Okay, and I should have just said that this portion right at the center here, this is the lumen of the blood vessel through which the blood will actually flow. Okay, so tunica means layer, basically. It's from the same derivative as tunic, okay, so it's a layer. And intima means close, okay, so this is the layer which is close to the lumen of the blood vessel. Okay, right, so the next layer surrounding the tunica intima is then the tunica media. Okay, now this is a nice thick layer, and it basically consists of a large number of smooth muscle cells along with elastic tissue. Okay, so let's draw this like so. So this layer, this entire big thick layer here, is going to be tunica media. Okay, tunica once again means layer, media means middle, so this is the middle layer of the artery wall. Okay, now what does this layer consist of? Well, it consists of a huge number of vascular smooth muscle cells. Okay, so what you're going to have is a lot of vascular smooth muscle cells. And for short, vascular smooth muscle cells are often abbreviated to VSMCs. Okay, so often people will abbreviate this to VSMCs for vascular smooth muscle cells. Okay, right. So these vascular smooth muscle cells, let's show a few on this picture. So this entire layer will have multiple layers of smooth muscle cells on top of one another. And basically the smooth muscle cells are connected in rings. Okay, like so. So you'll have these rings of vascular smooth muscle cells extending the full way round the blood vessel, basically. So they'll go around the entire circumference of the blood vessel, and let me show this here. And now what's the significance of these rings of vascular smooth muscle cells extending round the entire blood vessel like this? Well, if you think what's going to happen when all of these smooth muscle cells contract, they're all going to become shorter, basically. So all of them will reduce their length. And what's going to happen if they all reduce their length? Well, the entire circumference then of the ring will have to go down, because the circumference of the ring is all of the lengths of the smooth muscle cells added together, or at least roughly. So, when all of those lengths of the individual vascular smooth muscle cells go down, that will mean the circumference of the entire ring goes down, and when the circumference of this ring goes down, that will mean that the diameter of the ring goes down. And then that's going to basically constrict the layers underneath, so you're going to basically reduce the diameter of the entire blood vessel. So, the smooth muscle cell layer of the artery determines the diameter of the lumen, fundamentally. Okay, right. So, this layer, tunica media, can vary depending on which artery you actually look at. If you look at an extremely muscular artery, such as the carotid artery, which is the one I originally said we were going to look at, it would have a very distinguishable layer of smooth muscle cells. Whereas if you looked at a more elastic artery, such as the aorta, you'd find that there were less smooth muscle cells in tunica media and much more elastic tissue, okay, to make the aorta much more stretchy than the carotid arteries. Okay, right. So let's continue on, going outwards from the tunica media then now. So we're going to go on to the tunica adventitia now. And the tunica adventitia consists of connective tissue. So the first layer of the tunica adventitia is the external elastic lamina. So you have another layer of elastic tissue lining the tunica media. So I've coloured this in the same colour as I coloured the internal elastic lamina in. But this now is the external elastic lamina because it's more external than the internal elastic lamina. Okay, so the external elastic lamina is considered part of the tunica adventitia then. Okay, and surrounding then the external elastic lamina, what you have is now a layer of connective tissue. Okay, so this is collagen mainly. And in this connective tissue, you'll have blood vessels which supply the wall of this massive artery. Those will be located within this layer of connective tissue. And those blood vessels which supply the wall of this massive blood vessel, they're known as vasa vasorum. Okay, so within this outer layer of connective tissue, you have vasa vasorum. Okay, and these are little blood vessels within this outer layer of connective tissue. Okay, like so. So that's a vasa vasorum there. Right, so that's the structure then of an artery, okay? And that's going to be extremely important for us to understand when we're going to talk about the pathogenesis of atherosclerosis. Specifically, we're going to see that atherosclerosis is a disease of tunica intima, and the main site of engorgement is going to be this subendothelial connective tissue here, or this subendothelial space as we also called it. Right. Okay, so the next prerequisites that we need to discuss before we can move on to the pathogenesis of atherosclerosis is we need to make sure that everyone knows and understands what low-density lipoprotein is, or LDL. Okay, so let's now discuss this here. So we want to see what low-density lipoprotein, also known as LDL, actually is. So we want to see the structure of these things, and then we'll see their involvement in the pathogenesis of atherosclerosis. Okay, right. So basically, you cannot dissolve lipid molecules within the blood. Okay, at least not large lipid molecules. So, for instance, molecules such as cholesterol, or even worse, cholesterol esters, have a very difficult time dissolving in the blood, and the reason is that they are extremely neutral molecules. Okay, so in order to be considered a lipid, the quality that you need to have is that you are hydrophobic. Okay, which means that you do not interact well with water. Now, why do you not interact well with water? Well, it's because your structure is very neutral. Okay, whereas water's structure is very polar. So let me explain what I mean by that. So I think it's best to start by looking at water and then seeing what's different in a lipid molecule. Okay, so if we look at water here, basically these bonds between oxygen and hydrogen, they have two electrons in, one from the hydrogen and one from the oxygen. Okay, and that's in both cases. They're both exactly the same, so we'll just draw one. Okay, now the question is, do the electrons that are in this covalent bond that are being shared between the hydrogen and the oxygen, do they sit evenly between the oxygen and the hydrogen? Do they sit exactly in the middle, or do they end up pulled over to one side? And the answer is that they end up pulled over to one side, and they end up pulled over to the oxygen side. And now let me explain the reason. Okay, so basically, the nucleus of both the hydrogen atom and also the oxygen atom contains protons. In the case of hydrogen, it only contains one proton. In the case of oxygen, you have far more. Okay, so these protons will have a positive charge, and therefore they will exert a pull on the electrons within this covalent bond here. Okay, so basically, the question is, which nucleus pulls on the electrons harder? Well, it's the nucleus of the oxygen, and it's more complex than just asking, well, how many protons do each of them have? You might say, well, the oxygen nucleus has more protons, so obviously it will pull them harder. You also have to take into account the number of electrons that are circulating around the nucleus, and therefore are shielding the positive charge and repelling the electrons. So what you're really asking is, how attracted to this oxygen atom are these electrons that are in this covalent bond versus how attracted they are to this hydrogen atom. Okay, and the fancy word for how attracted the electrons will be to a certain atom is electronegativity. Okay, so basically, we would say that oxygen has a greater electronegativity than hydrogen, and what that means is that the attraction that the electrons feel towards the oxygen is greater than the attraction that they feel towards the hydrogen. Okay, so that's what is meant by oxygen having a greater electronegativity than hydrogen. So it means that the electrons in these covalent bonds will sit towards the oxygen atom and away from the hydrogen atom, therefore giving the oxygen atom a partial negative charge, okay, whilst the hydrogens get a partial positive charge because the electrons are sitting towards the oxygen, giving it a slight negative charge, and away from the protons, or the hydrogen atoms, giving them a slight positive charge. Okay, so this is what is meant when we say that water has this polar structure. This side is negatively charged, this side is positively charged. Okay, now this allows water molecules to interact absolutely brilliantly with other water molecules. Okay, so if I bring another water molecule in here, this oxygen, as well as having this partial negative charge, will also have lone pairs of electrons. It actually has 2 lone pairs of electrons. Now, basically, this lone pair of electrons is a wonderful centre of negative charge. Okay? In addition, the oxygen overall has a partial negative charge. This hydrogen here has a partial positive charge. So this partially positively charged hydrogen can form a beautiful interaction with the lone pair on this partially negatively charged oxygen. Okay, and that beautiful interaction is known as a hydrogen bond, and it's really quite strong for intermolecular bonds. Okay, right. So water molecules can interact very nicely with other water molecules, whereas these lipid molecules, okay, they generally consist of a huge number of carbon atoms bound to hydrogen atoms. Now, carbon and hydrogen have roughly the same electronegativity. Okay, so if you have a covalent bond between a carbon atom and a hydrogen atom, okay, the electrons roughly sit in the middle and there's no polarity to this bond. So you have this over and over again with no polar structures, okay, and those sort of molecules find it very difficult to interact with water. The reason is that if you bring a water molecule and ram it against one of these molecules, they will not form a very strong intermolecular bond. It won't be repelled from it, okay, but it just won't form a very strong bond. So, to get a water molecule to interact with this, you have to break its bonds with other water molecules. Now, to break the bonds between it and other water molecules, you're going to have to put in a lot of energy, okay, to break these hydrogen bonds. And then what are you going to get out of doing it? You're going to ram the water molecules up against this hydrophobic structure, and you're going to get hardly any energy coming back out, okay, because the interactions it will form are really weak. So basically it's just not energetically favourable. It's far better for water molecules to interact with other water molecules and shove all the lipid molecules together, basically, okay, so that they can all interact really weakly with each other, but at least they're not getting in the way of the water. Which is why when you mix fat, okay, so some sort of oil with water, the two separate off so that the water molecules can interact with each other in this very favourable way, and then all the lipid molecules are just left to interact with each other, and who cares about that, basically. Yes, the lipid molecules can't actually interact with each other that strongly, but at least they're not getting in the way of the water molecules interacting with each other, which is a very strong interaction. Okay, so lipid molecules struggle then to interact with water molecules. Okay, so you can't just chuck lipid molecules into the blood and expect them to be delivered around the body. Instead, you have these structures called lipoproteins, whose job it is to deliver certain lipid molecules to sites in the body. Now, low-density lipoproteins, the main sort of lipid that is delivered to tissues by low-density lipoproteins, or LDL molecules, is cholesterol. Okay, so we will continue our discussion of LDL and the structure of the different lipids within it in the next video.